recording this so we can actually have it for tomorrow. We'll be reviewing the general office workflow, the scheduling of patients, patient demographics, features of the patient list, patient handouts and insurance, meaningful use measures, and patient comments, messaging, and tasks within Azalea. I'm going to scoot this over to my screen so you can see. Now for the front office, they're mainly going to be using the home, the scheduler, and the patients tabs within Azalea. When you log into Azalea, the first screen that you come to is your office overview. This office overview is tied directly for your scheduler for that day. Now you're going to want to, I'm sorry, right here? Okay, excuse me, I'm sorry. Now, this, like I said, this is linked to your scheduler for that day. And in this view, you're going to see all of your upcoming appointments, and you're going to see all the completed and missed appointments for that day. In the office overview, you have your filters, so you can filter to a specific office view or a specific physician scheduled if you're just responsible for one physician schedule. That'll help you in filtering. You also have your clear room flags, and we'll discuss that a little bit more in more detail in a moment. You have your walk-in tab, which is going to allow you to easily schedule a patient from this screen if they're not already on your schedule. So as the patient comes in, you're going to want to mark them arrived by checking on the checkbox so that they actually come into your waiting area. Now at this time, depending on your office protocol, you're going to want to click on the patient's name, and we're going to want to see if they have any credits, any copays, and you're going to want to take their copay and go through that whole scenario. And we did that by actually clicking on the patient's name and opening the Edit Appointment tab. In the Edit Appointment tab, we have the checkout, we have the reschedule, so if that patient were not to show up but call in and reschedule, we could use this. We have the Take a Payment tab, and this is used for your co-payments and your balance payments. And you can also print these out. If you are responsible for adding pharmacies, you would want to do your prescribe link and add the patient's pharmacy. You also have this quick access drop down for more, where you can go directly to the patient's record, and you have the ability to choose from all of these options. Now you also want to quickly scroll down and you have your patient summaries. So if we wanted to click on the patient summary and just see really quickly who the rendering provider was, or if any of this information was accurate, we could click on the plus sign for any of this. We could click edit, and it would take us to the patient record so we can actually modify that. And you can do the same for any of these that are in the patient summary. You can edit and verify insurance, and also scan in the insurance cards and access any of that from the patient's appointment screen. Now once you've done that and the patient's in waiting, the nurse or whoever is deemed responsible in your practice is going to move that patient to an exam room to start the process of the physician charting and charting that visit. When they are done charting that visit, the nurse or the physician is going to move your patient to checkout. And once the patient's in checkout, we want to, if you then take the patient's payment, or if you need to reschedule for a follow-up appointment or schedule any tests, you would click on their name again and go back to that Edit Appointment screen. At this point, if you needed to take the payment, you would click on the Take Payment, but if you needed to schedule a new appointment, you would click on More and go to New Appointment. Now this is going to take you directly into the scheduler mode, and this mode allows for multiple appointment scheduling. So we come up on the day of service, and then if we just needed to schedule her for a week, then we would click on the 17th and then click in the slot that we wanted to schedule this patient for their follow-up, and then submit. Now, if she had several appointments, we would stay in scheduling mode, and then we could just use this jump to jump to 5 weeks out. Let's say she had post-op and pre-op appointments. So I just clicked in the box for the number of weeks or days that I want to schedule out, and I chose the drop-down that I needed, and it took me to November the 14th. So I would click in the appointment that I wanted to schedule the patient, and then click Finish to let it know that I'm done scheduling this patient. I can also quickly get back to my current day of service by clicking on this Today button, so I can quickly get back to where I was working. You also, on the left-hand side, have your views for your scheduler. Here again, if you are only responsible for a specific physician or a specific resource and you don't want to see all of the other schedules, you can choose which one you want and you will only see that schedule. Another great feature about the scheduler is this quick schedule actions drop down. You can easily print your daily schedules. You can print just a specific physician schedule. You can print the patient demographics for them to verify. Print your face sheets, labels, and your phone reminders report. Now within the scheduler, we have the recall button. And this is important for meaningful use. This is a measure that's going to help you track meaningful use within your system. For the recalls, you can click on the Recall tab, and you can create a recall by clicking New. And then you're going to add the patient, and you would search for that patient and click on their name, and it attaches them to that. And the physician, you'll go through and add the physician. You'll add your reason why, for whatever, these are tied to your appointment reasons. And we'll just say they need pre-op. And then make sure if you have different locations, if you want them called the day before, and then put your date that you want them to be called. And you can put in any notes or anything like that, and it's going to look just like you see here. You're going to see the patient, the information about that patient, their phone number, and the patient needs follow-up labs or whatever you're needing to contact that patient about. Now, if you wanted to generate it just for one day, you can set your parameters up here and then tell it to go. You can also create a PDF or Excel list for that. You also can filter by location and provider and reasons. You can also filter by has or has not been contacted. You can work from this screen, and when you call the patient, you have the option to schedule the recall while you're on the phone. You can edit that recall with a note, or you also need to pay attention to your more drop-down so that you mark the patient that they need to be followed up with. They either need to mark as not contacted or mark as scheduled. If you mark that patient as scheduled, it's going to take them off of that list because that's a completed recall. And then if you have contacted them, maybe you left a voice message, you need to mark yes, but you might want to leave them on the list. So this is a good option that you need to take note of. Now notice within Azalea, you can always tell what location you're working from because it's going to be highlighted in bold. So we're in the scheduler section, and that's highlighted bold and blue. And then also the recalls tab is in blue to let us know that's where we're actively working within. So if I clicked on the patients tab, I now am actually have that bolded, and the patients tab is bolded. Now within the patients section, we have the patients tab and the charts tab. The front office is mostly going to be working from this patients tab, and you'll see that we have the patients list. That's the first thing you're going to see when you come in. And notice that you can filter your patients, or you can click on your alphabetize and click to certain patients, and you can click back on all, or you can just filter by gender, different statuses, insurances, and quickly access a certain type of patient. Now when you're looking at the patient screen, if you look at this first patient, Jeanette Anderson, you'll see that she's kind of grayed out. So if you come over to her status, you'll notice that she's inactive. So all of your inactive patients are going to be grayed out. And then your completed patients look like these patients. And then you'll notice down here, this patient is in yellow. This means that our patient has some incomplete demographic information, and we're going to need to edit that patient when they come in and update their information. Now, to actually search for a patient, we're going to click in the search window, and we'll look for Miss Imaginary, and then we can click on her name. Now, you don't have to search by last name. You can do first name first, or you can search by different patient identifiers like Social Security and date of birth. So I'm going to click on Mary Imaginary, and this is going to open up her patient dashboard, her record. You'll notice on the left-hand side that there are all of these options to choose from. You have your medical, your billing, but you're mainly going to be concerned with your patient details, which is going to give you your quick dashboard, which is your overview, and then you have your demographics, your insurance, and your document section. Your document section is going to be where you want to store your labs and any patient reports that need to be associated with your patient. You have your patient handouts for school excuses and any patient information. Your comments, and this is going to be for non-clinical information, phone calls, and things like that that you want to actually notate and have attached to that patient's chart. You have your task, and we're going to talk about that in more detail in a moment. You have your appointment list, which tracks your patient appointments, and you have your recall list from within the patient. So you have multiple ways of tracking and creating those recalls. Now, if I want to, you also have the patient actions, which is going to allow you to have quick access to print their demographics and just have some really quick access to do some functions right directly from the patient's record. You'll notice that what I just did was I clicked on the minus button so that I just have a brief overview of everything in the chart, and I can just click on what I want to see. So I did that. You can plus and minus do that by doing that. And my screen is okay. So we'll go back here. Now, if I needed to edit that patient, I would click on Edit, and notice that it changes this bar to red. So anytime you're in Azalea, blue is your view mode and red is your edit. So we're going to leave Miss Imaginary, and let's say we needed to actually add a new patient. Now, I don't know if you noticed while we were in the home screen of the scheduler, this new patient tab is also available in the same area, so you can easily add your new patients. So we would click on New Patient, and it's going to launch our patient demographics window. You're going to notice in this window that you have the red required fields, and these are based on what you would need to submit a claim. So I would drop this either to insurance or self-pay, and then notice that you have the option to sign up the patient for your patient portal. If you check this button, then you're going to need to make sure you retrieve a patient email, and that's how they're going to access their patient portal. So we're going to select the rendering provider, and then we're going to put in, we'll create, let's do Sally, test, and we have to provide a date of birth. And that's we'll go through the female as a required field, and this gender and race are part of the meaningful use as well. So you have these options. If they decline to specify, make sure that you at least go by and fill these in. And then we're coming down here. So now that I checked the patient portal, it has made this email field a required field. So I'm going to type in that patient's email. Now, if the patient declined to provide or patient doesn't have one, then you would want to notate that as well, because you want to track that you're actually providing and giving, letting them know that they have access to their patient information. We'll get the address in here. And you'll notice when you're putting in the address, it doesn't ask you for the city or the state. It's going to take you directly to the zip code. Oh. And then you have the option to validate and make sure that address is a good address. You do need at least one phone number for that patient to be considered complete. And we'll scroll on down here to the guarantor section. Now, if this were a pediatric patient or an underage patient and you had the mother or father was also a patient, you would want to link that patient to that guarantor by clicking on the icon and searching for that guarantor. If the patient is if the guarantor is not a patient and you need to add that, you would click on the relation. If it's that person is their own guarantor, click on self, and it's going to fill in those fields for you, which makes it really simple and easy. And then you're going to go through, you have your primary insurance, your secondary, and your tertiary insurance, and you add those by just clicking on your primary insurance or your insurance button, and all your preloaded insurances will be available for you to choose from. At this time, you would want to scan the insurance card, and if you wanted to verify it, you could do that as well. Be sure that when you're done with that portion, that if your patient has asked for a clinical summary or a copy of their information, that for meaningful use purposes, you want to check on the electronic health information requested and provided. And now if I just wanted to continue with this patient and I needed to schedule them or do something with that patient, I would just save and view. I'm going to save and close, and that's going to completely close out the patient. Now it's alerting me and telling me the following fields are required: primary insurance. Do you want to save anyway? And for our purposes, I'm going to say yes. Now you do have the option to make those required, and they can't save it until they take it, enter that for the patient. But that will make it difficult for any new patients that are calling in that want to get scheduled. I want to bring you back to the task. We briefly mentioned that when we were in the patient record. This is a really good option within our system to track interaction that you need to, with your patient, that you may need to actually take actions on. For example, if you're trying to track patient med refills or office messages and things like that, you're going to want to utilize the task in the system to keep those attached and keep track of those. And you can do that from within the patient record, or you can use the actual task icon that is in Azalea. Now, all of these icons follow you no matter where you are within Azalea, so you'll have easy access to them. Now, to create a task, you can simply click on the task icon and then click on New Task. So if Sally Sue called in and needed her medications refilled, we would just type in med refill, type in what medication she needed refilled in the description, and then we would attach the patient, and we would click on Find Patient, and then find the patient and attach them. Give it a category. Now, all of these categories are preset by your administrator or your office manager, so they would have these drop downs preset for you. And then we want to assign who is supposed to take action on this. You can either assign it to a group, or you would assign it to a specific physician. And we're just going to pick myself. You have the option of putting in an expiration date, or you do not have to, and you submit that. Now that person is going to get an alert, and then they're also going to see in their task that they have tasks that they need to attend to. And it's going to pop up in there. When they click on that task icon, it's going to look just like this. And then they would click on Edit. They would call the patient, make whatever comments they needed to, say patient meds called in to pharmacy, and then they would submit. And at this point, if there was no further action, they would want to drop that to completed status, or if there was something else that needed to be done, they would either assign it back to the sender, or they could send it to someone else. And you just want to click Submit. So now that task is complete. And this can be done for labs that the physician wants the nurse to call on, the patient, and update them on their labs, or anything that you need to track within the patient record. And that now is going to be attached to that patient's record. So if I go to Michael Anderson and then I click on his task, then I see these tasks that have taken place and are attached to him. And that is going to be our office overview for today. If you want to go ahead and enter any questions that we need to address and answer for you at this time, we'll be happy to take those. Okay, I don't see that we have any questions. We want to thank you for joining us today and remind you of some other upcoming webinars that we have. We have the Quick and Simple Billing with Azalea Thursday on October 24th at 9:30. We also have the ICD-10 Survival Program webinar that's going to be coming up the third Wednesday of every month. We'll start that on October 16th from 12:30 to 1:30. Open registration for the ICD-10 Physician Survival Program is available, and the Azalea customers will receive a 10% discount. So if you have any questions about that, you can email marketing at marketing@Azalea.
Yeah, and I would like to add one more thing about that, Marty. If you are interested in registering for the ICD-10 Physician Survival Program, you can find a link to that on our blog, or on our website. If you go to azaleahealth.com and you go to the second slide on the home screen and click that, it'll take you to some more information, and you'll find a link to how to register for that on down the page. We have a question asking when the next webinar will be available, the recording, oh no, the registration, excuse me. The registration will be available, it's actually available now. I can send you a link directly. I can directly send you that link, and the invitation for that will be going out probably on Monday of next week. Okay, if there are no more questions, I'd like to thank you guys again for attending with us. And Marty, thank you so much for taking the time to do this with us this morning. And I guess everybody have a great weekend, and we'll see you next time.